The highest ever daily COVID-19 death toll has been recorded in Trinidad and Tobago. This as the Ministry of Health confirmed the deaths of 37 people in the last 24 hours. According to the latest update, the recent deaths take this country's total deaths for the virus to 2,718. Among the fatalities are 12 elderly males, 10 elderly females, 10 middle-aged males, 4 middle-aged females, and 1 teenage female. The Ministry of Health reports there are also 964 new positive COVID-19 cases, taking the active cases to 16,543. 94 people have been discharged from public health facilities, while 508 patients remain at hospital and are being treated for the virus.
In other news, the Minister of Health says they will not turn a blind eye to residents in Freeport that have concerns about a planned facility to store the bodies of those who succumbed to COVID-19. Residents of Bukaro Village recently held a meeting to voice their concerns about the proposed facility. Mr. Dayal Singh, however, says a meeting has already been scheduled with the villagers.
So we saw those reports about the residents in Bukaro, and I have spoken to Mr. Belgrove of the president of the funeral home this morning. He'll be having a meeting with them because we take joint responsibility for that, the Ministry of Health and the funeral homes. He has scheduled a meeting with them at their earliest convenience, and he will be addressing all their legitimate concerns. We cannot and will not turn a blind eye and a deaf ear to those concerns. They are legitimate.
Meanwhile, Mr. Dayal Singh adds that a meeting is also scheduled with the Tobago Regional Health Authority to discuss health issues on the island.
A meeting with the new Secretary of Health for the TRHA. I reached out to her yesterday through my office, and we'll be having a meeting next week, Tuesday at 1 o'clock between the Ministry of Health and her team, and we will continue to advise and support the TRHA in the same manner we did.
However, Mr. Dayal Singh said there are ongoing talks at the level of the Chief Medical Officer and County Medical Officers of Health.